What is CSF analysis for dementia detection? Imagine peering inside the brain's surrounding fluid to find clues about memory loss and cognitive decline. Cerebrospinal fluid analysis is a test that does just that. It involves collecting a small amount of fluid from around the brain and spinal cord through a procedure called a lumbar puncture or spinal tap. This is a minimally invasive process where a healthcare provider inserts a thin needle into the lower back, usually under local anesthesia, to draw out the fluid. The goal is to look for specific proteins that can signal early changes in the brain related to dementia, especially Alzheimer's disease. The main focus of this analysis is on two key proteins, amyloid-beta and tau. In Alzheimer's disease, abnormal deposits of amyloid plaques and tau tangles build up in the brain. These deposits cause characteristic changes in the levels of these proteins in the cerebrospinal fluid. Typically, in someone with Alzheimer's, the level of amyloid-beta 42 decreases because it's being deposited in the brain, while levels of total tau and phosphorylated tau increase, reflecting nerve cell damage and tangles. These protein changes can be detected even before significant memory problems appear, making CSF analysis a sensitive tool for early detection. Using this test can help doctors distinguish Alzheimer's from other types of dementia or cognitive issues. Combining measurements of these proteins improves the accuracy of diagnosis. For example, the ratio of phosphorylated tau to amyloid-beta 42 is a strong indicator of Alzheimer's disease. This information can guide treatment decisions and help exclude other causes of memory loss, such as infections or other neurological conditions. The procedure itself is generally safe and well tolerated. Some people might experience a headache afterward, but serious side effects are rare. Compared to other diagnostic options like brain scans, CSF analysis is often less expensive and provides detailed information about multiple proteins at once. It is especially useful when early or accurate diagnosis is crucial, such as when considering clinical trials or planning care. Currently, CSF biomarker testing is a valuable tool used by specialists to support diagnosis, especially in the early stages of dementia. Efforts are ongoing to standardize testing methods across laboratories, which will improve consistency and reliability. As research advances, CSF analysis continues to be a promising resource in understanding and diagnosing dementia, helping clinicians provide better care and support for individuals facing memory challenges. If you or a loved one are considering this test, it's important to discuss the benefits, risks, and what the results might mean with a healthcare professional. Remember, each person's situation is unique, and diagnosis should always be personalized. CSF analysis is just one piece of the puzzle in early detection and management of dementia, complementing other assessments and emerging research efforts aimed at improving outcomes for those affected.